We've been getting a lot of questions about the Republican tax plan from the House and Senate, and we're not experts to tell you the details.
So here to answer some of those questions is Dr. Nicole Saphier. Thanks for coming.
Good morning.
We have a lot of questions, so we're going to get right to it. So the first question comes via email from someone named Peggy, and Peggy says, no, the tax is not part of this bill. However... Oh, no, I'm sorry. Will this plan roll back businesses being taxed for providing health care insurance that took effect under Obamacare?
So the answer to that is actually no. It's not part of the bill. Yes, you were. Thank you. You want to continue? So, no, it didn't specifically roll back the taxes on the insurance companies, but the insurance companies are going to benefit from the corporate tax decreases as well as some of the improvements for small businesses. So they will be seeing help in that way. But no, does not specifically take away that tax that's implemented under the Affordable Care Act.
And of course, we still have to see a final bill signed into law because they got to merge the merged beliefs beginning today. Meanwhile, this email from Steve. Steve says this: will this plan repeal the penalty tax individuals have to pay if they are unable to afford health care? That's a huge one.
That is the stark difference between the House bill and the Senate bill. And although it does not do away with the requirement to have insurance, it does away with the fine. So therefore, people are no longer going to be financially penalized for not having health care. And that is a big deal.
So think about this. These exchanges are going maybe more and more expensive. Deductibles are going higher and higher. And then you say, I can't afford that. OK, then take a penalty. That's a horrible cycle.
That's the big problem, is that you have people that can't afford health insurance, and now you're penalizing them and having them pay even more money because they can't afford health insurance. And so these people are suffering. So this is a big win for them. There were some late night, early morning handwritten amendments in the margins to make sure that we're stabilizing the market share or the marketplace for this. But, you know, this is a big win for the GOP in this tax bill. If it is able to get out of the Senate.
It's not in the House, it's in the Senate.
That is a huge difference. Right, yeah. And in the past, the House has not been able to repeal this mandate. So whether or not they're going to get out this week, I'm not sure.
All right, so here's an email from Glenn. My 86-year-old uncle relies on the deduction for assisted living expenses to be able to afford to live at his assisted living facility. Will that be the case?
And this is also the number 2 big difference between the House and the Senate bill: being able to deduct your medical expenses. And although only about 9 million people really use this when they file their tax returns, of those 9 million people, this makes a big difference for them, especially a lot of senior citizens, people who are disabled or in long-term assistance facilities. The Senate bill, yes, you are able to deduct your medical expenses, and it makes it even better. No longer do you have to reach the 10% threshold of your income. They've actually dropped it down to 7.5%. And that is a big deal, and that's going to help a lot of people.
This email is from a man, so I'm going to you do it because I have probably more apt voiceover. Stephen says this: how will the new tax bill affect Medicare?
That's a great question. And although there's nothing specifically in the bill changing Medicare, there is going to be a trickle-down effect. Whenever you introduce more deficit to the budget, something that calls pay-go or pay-as-you-go kicks into action. And that essentially is you have to cut. And some of those cuts come to Medicare. Medicare is capped at 4% cuts. However, they can do away with that if they write into the bill saying, you know, this does not include pay-go, or we're getting rid of pay-go, then that won't necessarily happen. But Medicare, as it is right now, is on an unsustainable path. We are going to be seeing cuts regardless in the future. This will hasten it, but we do need to make some major reform changes to our Medicare system regardless.
And I heard the president over the weekend, it's going to be welfare reform and Medicare reform
Big
after
deals.
this gets done.
Yes, and that is so important.
If you do it bipartisan. So this where if you go to do it, they say, oh, he doesn't like poor people, as opposed to let's work on this to reform.
The only way to get out of this, to get something together right now, is to have bipartisan support. They will need bipartisan support to do away with pay-go. So whether people want to act as obstructionists or really move forward for a bipartisan solution, we'll see.
Yeah.
We will see.
All right. Thanks, Dr. Saphier.
Thank you guys for having me.